Good afternoon, I'm Greg Sherwood. I'm CTO at VOCxI Health. We're here to look at breath analysis as a way to detect disease, and one of our first focuses is lung cancer. It's the number one killer of people in the United States and the world. It's a $50 billion cost to the U.S. every year, and there's a low screening capacity or compliance to this. Medicare provides free screening to people at risk. Only 4% of those take advantage of that. So the key to addressing this is that get that detection early, and you can get 10 times better outcomes and 10 times lower cost. So our solution is an early disease detection via breath analysis. We can do it anytime, anywhere, non-invasively. So it involves 1 minute of breathing into our sensor technology. We produce a breath print. This is actually breath prints from our latest clinical trial on lung cancer. So you can see the healthy versus the disease. And then we use a machine learning to categorize those breath prints. So as we grow, we can do many different diseases based on the breath print library. So what are we sensing? It's volatile organic compounds. So these are small molecules that are produced by metabolism in your body. And there's probably 1,000 in everybody's breath, and that combination changes as you have a disease involved. So this bar chart right here is from literature based on lung cancer. And the green bars are the concentrations of VOCs that are in healthy people. But when you have a disease such as lung cancer involved, those concentrations change, as well as new concentrations of VOCs that get created. So what we've produced is a platform that doesn't just measure the new concentrations of materials, but it takes into account everything that should be there. And those changes are created in this pattern that we can detect as the presence of the disease. So we didn't actually invent or discover VOCs. They've been studied for decades. There's libraries of literature that tell us what VOCs are produced by what disease state. So we have a huge platform that we can analyze. This is one example of lung cancer. There's actually 4 different subtypes of lung cancer, and each one has a different pattern. So what we've designed is a sensor technology that takes into account all the different chemicals that get created, the VOCs that get created based on this metabolism. And in early research, we've been able to clearly separate small cell lung cancer from other lung cancers. In our current study, there's data showing that we might be able to actually subdivide all those cancers. We started this about 9 years ago at Boston Scientific. We started by proving that our technology can sense in the part per billion level, which is what these chemistries present themselves as. We've grown it into a system that is miniaturized into a 3x3 card right now. And this is a picture of our sensor. It's actually based on graphene, which is a single layer of carbon, very sensitive, and we've been able to manipulate it so that we can add chemical coatings to it. So we put 40 sensors on this chip. Each one has a different coating on it. So we sense basically 40 different families of chemistries in this technology. Our patent portfolio, we have 26 granted patents at this point. We have 30 more in process. They cover everything from the graphene structure to the chemical coatings to how we collect breath, how we measure it, and how we present it to the doctors. So we've done 3 clinical trials. 2 we've completed in lung cancer that shows significant separation between cancer and non-cancer. We did one in COVID as well. We just finished our 3rd study in lung cancer, and we developed a sensitivity and specificity of 94% and 92%. We have interest from medical and surgical oncologists, and there's several different health systems such as UC San Diego and the University of Minnesota that are interested in this, as well as international healthcare agencies. So the competitive advantage is that with liquid biopsy, they are expensive and they don't. Sorry. All right, and that's our talk. Any questions? I got cut off.
Well done. I'm curious when you put this into use. Is this something you use in some sort of preventive care that you would use on a patient and then you notice a change? Or is this something that you would engage a patient in because they have certain symptoms?
So we can use it in both. So we could use it in the initial detection of the disease, and we can use it also in follow-up. Many cancer patients have radiation CT scans that they have to follow every 3 months for several years after a cancer, and we can do that without radiation as well. So we can have applications in both places.
How sensitive is the measurement to like eating and drinking or other kinds of things that just could be sort of on your breath? And are there, I assume you have protocols for kind of using it that get around those sorts of confounders?
So it's a really good question. It's actually, all of our testing, we've always asked for people not to eat or drink for about an hour before. Most literature does that as well. So we haven't actually seen any complications with eating or any kind of dietary things. With smokers, literature supports also that if you ask them not to smoke for 2 hours, then the chemicals from smoking is pretty much cleared from the metabolism. So we haven't seen those kind of complications. So.
Do you expect this to come out at a price point that would be low enough that you would just start doing something like saying everybody over 70 gets screened?
Yeah, so that is actually the long-term goal. So we believe that we can get to that point if we, this is a semiconductor-based technology, so it definitely gets cheaper with volume. So we can ramp up to volumes. It would be something that you could do longitudinally. You could take a test every month or every 3 months, every year, just to build a longitudinal history of what you're getting.
Are there drawbacks to broad early detection of cancers? There's some, prostate cancers that are very slow growing that if you detect it early, you may end up getting an unnecessary procedure. But there's a lot of debate about what is and isn't unnecessary. How do you balance that?
So I think that's the genetic problem that they have with early detection, is that genetics can shed, and there could be cancers that actually the body kills, that they can cause those kinds of complications. What we're looking at is an actual change in VOC concentrations that are created by that disease. So when we sense that, it is present.
Maybe I missed this, but are you envisioning this as sort of like point of care diagnostic or over the counter, or are there pathways for doing both?
So initially it would be in an oncology setting primarily, but as we gain more data in the machine learning in our library, we will move it into a point of care system where it could be done annually, as well as follow up on other things.
Clearly everything you've shown us is on lung cancer, or you mentioned COVID as well. Is this something where things would show up in from other types of cancer elsewhere in the body that might be presented in the lungs?
Certainly, there's comorbidities that we think about, and the literature supports, as well as some of our own testing, is that the signals from different cancers are completely different. So you may run into a colon cancer while you're looking for lung cancer, but those are separable based on the machine learning capability.
But you think those would actually be detectable in the lungs?
Yes.
I mean, in breathing?
So there's many cancers that are detectable in the lungs. The process is that these chemistries don't want to dissolve in your body. So no matter where they're generated, they are put into the bloodstream and your body gets rid of them through the lungs. So many cancers are detected regardless of where they are in the body.
One more question. Do you think the sensors could be used to detect volatile organics in other contexts, like, for instance, like on skin?
Yes. Yeah, they can be used on skin. We haven't tested that yet, but there are emissions of VOCs from skin, also from other body fluids, saliva, urine, feces. So we can do that all in a container type of PET space analysis. It's not based on breath, but the highest concentration of VOCs from the body is through the breath.